Guys, Brent here in wonderful New York City. Just had my consult in person with Dr. Bluebond-Lagner not that long ago, and I just wanted to give a little update on how that went. So, unfortunately, I didn't hear the things I wanted to hear. So, I am a grower, not a shower, but I am flaccid 3 centimeters, which unfortunately, I may not be able to pee standing up. I may or may not be able to still penetrate because what Dr. BL does is they cut the ligament, which I talked about in my other video, so feel free to look at that again. And that can affect the potency of the erection. She also moves the scrotum up, so you're not sitting on it. But because of that positioning and the size, may not be able to clear the fly, peeing standing up, and it may look smaller. I also have a lot of loose skin. So for me, one of the biggest things is just looking down and seeing something. The mons also, I'm not going to get naked and show you, but the way it's pulled up, it's a little bit different than what you might think. So you can get the mons, resurrection or whatever it's called. Yeah, it might not be what you think. So it's kind of like they pull it up more from like the top than like down here, right? If that makes sense. With that said, I think Dr. BL is great. Dr. Zhao, also, really good, really informative. Very nice, very caring surgeons, a very nice, just setting. But yeah, metoidioplasty just might not be for me, unfortunately. So, I do have a consult set up with Dr. Miro in May. So I'm going to see what he says. But my main things are being able to pee standing up and being able to penetrate, and I just worry if I look down and I just don't see anything, it's just going to make my dysphoria worse. So people have gotten phalloplasty after metoidioplasty, but it's really not recommended. Again, I talked about this in my first consult too, so please go and watch that video. But basically they were saying, between scar tissue and just multiple surgeries on the body, it's really not recommended. You're probably going to have better results just getting one or the other. You definitely don't want to worry about scar tissue with the urethral lengthening, because they really essentially, you can get metoidioplasty, but then they kind of have to, it's a whole other thing to get phalloplasty, right? So they really have to almost undo, from my understanding, what it sounded like she was saying, the metoidioplasty. So that's not the best option. The best option is to know what you want pretty confidently going forward. So it was also asked, what I thought of her. I think she's great. I thought she was very, very nice, attentive. They answered all my questions. I was very happy with that. The staff was great. I was very happy with that. I was also asked about strictures and fistulas. So I don't remember exactly what she said. I can tell you, though, that she did say about 15% get stricture, and about 25% can get a fistula. So a fistula is basically like there's a disconnect. It doesn't heal in the healing process. It doesn't connect fully. So you have a space, from my understanding, between things, between your anatomy, right? So between maybe the shaft and your pelvis, or I don't know all those details, to be honest, but again, 15 to 25%, and it really just seems to be based on how you heal. There's really nothing in particular that makes it less risky or makes it more risky. So I guess it's just really how your body responds and how you heal. So that's that. Next step for me is my consult with Dr. Miro. Again, I'll give you guys the opportunity to ask more questions, and I'll try to address those. And if metoidioplasty does not seem like it is going to cure my dysphoria, And then phalloplasty is the route I'm going to go down. Now with metoidioplasty, no heavy lifting for 6 weeks. They want you to stay in the area for about 2 weeks. And everything is in one, right? I mean, I would have a second surgery for the implants, but other than that, everything is done in one stage. So that's a pro to it, as opposed to phalloplasty. You're looking at multiple surgeries, multiple stages. Metoidioplasty, I think they said 6 weeks, no heavy lifting. I asked what the healing time frame was. That's what they said. But phalloplasty, between the different surgeries and stuff, you are looking, it's 3 different procedures, and you are with about 6 months separate in between. So you're looking at about 1.5 to 2 years for just a complete, for everything to be completely done. And that's, of course, not including if there are issues, if there's a revision, if there's, just a setback that the person has to deal with. So I hope I answered some of those questions there. Again, I will keep you guys posted. Ask me more questions down below. I will document this experience, my lower surgery experience, one way or another. And then I will be signing off from YouTube to go live the rest of my life. But fingers crossed. My goal is to start this process before 40 years old. I will be 40 in December. I just turned 39. So it's looking really good for that. My insurance does cover both Dr. BL and Dr. Miro take my insurance, so that's great. And yeah, it's going to be a long road. It's going to be a difficult road. It's going to be physically and mentally challenging if I go down with phallo, but I've got to also consider my work situation, although it might be a really good time to just focus on those online clients. So, and I do offer online personal training. If you're interested in that, feel free to leave a comment. We'll get in touch. You can comment your email, or you can email me at freelandfitness@gmail.com. With that said, I think I've really covered everything, and I will be back to discuss this again in the future. Again, consult with Dr. Miro right now is scheduled for May, and I will be in touch with Dr. Bluebond's office if I want to go forward with the surgery with them, either metoidioplasty or phalloplasty. I have one note from my therapist, one letter rather. I do need to find another therapist, although they did say I had a letter from my endo, and I thought maybe that would have to be like really specific too, but they said in terms of the letter from the person who prescribes you testosterone, it's pretty basic. Just how long you've been on testosterone for, when you started it, what was your start date, how long, what's your dose, and if they personally feel, that you're a candidate or whatever, for lower surgery, if they think that's a good idea for you, kind of thing, you're healthy for it, etc. Right, you're mentally there, because that's the thing. These are irreversible changes, and there's a lot going on. Like non-binary is like huge, right? You get the Mr. Potato Head thing, whatever. People are accommodating. People are, there's so many different people in this world, but to get these surgeries, you have to be pretty darn positive that this is what you need. And again, this is not me. I'm not going out here telling anybody how to live their life or who you are or how you feel. But for me, I take this very seriously. For me, I very much feel like this is a binary male. I'm just male, period. I don't even see myself as a trans man. And I need to fix my body. For me to be comfortable, I need to have these surgeries. I need to look and sound and feel male, and I just simply do not feel male without the male genitalia. So that's huge to me and really important to me. Likewise, a big thing, if I look down, and I have a lot of loose skin from losing a lot of weight, as you can see here, okay, this is all skin. So if I look down, I want to be able to see my penis. And I do think, if I look down, I don't see that. I do think that I might be more dysphoric. So it's a lot to think about. It's a lot to think about, to be honest with you. On one hand, metoidioplasty, I've got great size. I like what I have now. It's I mean, I would like it better without the skin. I like it to an extent, right? Because I still have all this skin. I still have, it's still female anatomy to me, and messes with my head in that aspect. But I'm comfortable with it. So there's that. On the other hand, I don't want to go through with it and be like, oh gosh, I'm not happy with this. It hasn't cured my dysphoria, or worse, it makes my dysphoria worse. Right? So it's just a lot to think about. So again, the next step for me is having a consult with Dr. Miro, thinking about the things that Dr. BL said, and just going from there. If you have any questions, drop them down below. I'll see you guys when I see you. I really don't know what else to put in these videos moving forward, but if you'd like me to address anything, I can. If you're just watching my videos for the first time, I've been on testosterone since June of 2009, so coming up on 11 years now, or I'm sorry, coming up on, 11 years this June. I had a hysterectomy back in 2012, and I also had hot top surgery in 2011, so I'm just out living my life and trying to complete my life, complete my body, rather. This point in time, not a lot of people know that I'm trans, so there's really not a lot to talk about. Although I could make a video addressing a conversation I had with someone who basically called me out on being trans, because she had seen my scar in picture, and I don't think she did it in a mean way, but she called me out, right? So, yeah, I can make a video on that if you're interested. Anyway, leave your comments down below. And if there's anything you want me to talk about, let me know. Otherwise, I'll see you probably in May or whenever.